Director of Metro Nashville Public Schools, and Ginger Hauser, Vice President of Economic and Community Development at Nashville State Community College. Director Chief William Swan of the Office of Emergency Management at Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are here with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. Now, as we continue phase one of our roadmap for reopening Nashville, I am encouraged to see our neighbors and local business owners following public health orders and best practices as Nashvillians return to work and help us safely restart our local economy. Now, our roadmap was built on public health expertise and was created with careful planning, but we are in uncharted territory. So I urge everyone to take steps to protect themselves whenever you're out in public. This includes maintaining a safe distance from others, wearing face coverings, and practicing frequent hand washing. Now, last week, the Metro Public Health Department received a shipment of 25,000 reusable cloth masks from the state's COVID-19 Unified Command, and we distributed that allotment of masks to Nashvillians over the course of a single day, thanks to the hard work of our dedicated Metro Public Health personnel. We now have a second shipment of masks, which we will distribute with the help of Hands On Nashville starting tomorrow, May 15th, and Saturday, May 16th, from 9 a.m. to 1 p.m. at the Metro Southeast facility located at 1417 Murfreesboro Pike. A drive-through system for mass distribution has been set up to facilitate safe social distancing. Those arriving by other means of transportation will also be accommodated. Now, other mass distribution sites, including those at our community centers, assessment centers, and MDHA properties, will be announced later today. Now, yesterday afternoon, we received an update from the Vanderbilt COVID-19 modeling team, which reported that Tennessee is expected to stay far below mathematical models that previously estimated 1,200 concurrent hospitalizations by mid-May. In Nashville, no more than 200 patients have ever been hospitalized on a single day since our first reported local COVID-19 case on March the 8th. Now, this is encouraging news, but it must be received with cautious optimism. We have come too far and seen too many sacrifices across Davidson County to lose our hard-earned efforts. We have made significant progress in flattening the curve of COVID-19, but we have to learn to live with the presence of the virus in our community for the foreseeable future. Now, 1/4 of Tennessee's total confirmed cases have been in Nashville, a densely populated metropolitan area with a global tourism destination. But we responded early with a safer-at-home order, and the path of the disease has stabilized here with the help of our healthcare partners. We are closely monitoring our public health metrics throughout phase one of our economic reopening. And now I am saddened to report 4 COVID-19-related deaths in Davidson County residents this morning. Every coronavirus-related casualty is a tremendous loss for our community. But also, today's news is of 10 new confirmed cases, and our 14-day average continues to stabilize. Our hospital capacity remains satisfactory, and our local testing capacity is increasing. Since last Thursday, May 7th, 8,526 residents have received COVID-19 tests, an average of 1,218 tests a day, and that is a 22.3% week-over-week increase over the previous 7 days. Now, do not hesitate to use Metro's community assessment system if you suspect you have symptoms of COVID-19. Call 615-862-7777 from 7 a.m. in the morning to 7 p.m. in the evening. Our assessment centers are also open 5 days a week from 9 a.m. to 3 p.m. And as a reminder, Metro's Toolkit for Businesses features helpful educational resources for employers, including details of sanitization procedures, employee health screening guidelines, and other Phase 1 public health protocols at covid19.nashville.gov. Now, as I mentioned last week, we are asking all local businesses to comply with Metro public health orders. But we will also use appropriate enforcement actions as a resource to protect public health. This is to ensure a sustained economic restart without interruptions and not jeopardize our community's progress. Fines, revoked permits, and civil penalties will be used to keep staff and customers safe. This confidence in being safe is essential to Nashville's economic restart. And I urge all Nashvillians to thank those businesses that are working so hard to keep you and your family safe. Now, among the many Nashvillians who've made sacrifices over the past months are the students of the MNPS class of 2020. The coronavirus should not dampen what should be a season of celebration for their accomplishments. Now, my heart goes out to all high school seniors across Davidson County. I know this time of historic challenge has made an indelible impression on your lives. My only hope is that this hardship will build a spirit of perseverance and more compassion. Now, this morning, I'd like to welcome Dr. Adrienne Battle, Director of Metro Nashville Public Schools, who will discuss our school's ongoing remote learning efforts and provide an update on graduation ceremony plans for MNPS seniors. I'm also glad to welcome Ginger Hauser, former Metro Council member and now Vice President of Economic and Community Development at Nashville State Community College, who is with us this morning to discuss several free online courses in professional development currently being offered by Nashville State. These courses are designed to help Davidson County residents who are either seeking new job opportunities or are preparing to reopen their small businesses during this time. And as always, it is a pleasure to welcome Dr. James Hildreth, President and CEO of Meharry Medical College, with his insightful commentary on both COVID-19 and our community's response to the disease. And finally, I am very proud to announce that the U.S. Navy Blue Angels will be flying in formation over Nashville at approximately 12 p.m. today. And I encourage everyone to take a moment to safely step outside and witness this magnificent tribute to our healthcare workers, first responders, and other essential personnel on the front lines of our coronavirus response. And as always, please consider contributing to the COVID-19 Response Fund or visit Metro's COVID-19 website to learn how you can obtain direct financial, food, mental health, and social service assistance. And now I'll turn it over to Dr. Alex Jahanger, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus in Davidson County. As the mayor noted, we have had 4 deaths reported to us as a result of the virus. A 74-year-old gentleman, a 70-year-old gentleman, a 67-year-old man, and a 46-year-old woman. All had underlying medical conditions. My sincere sympathy goes out to all of them and their families and friends. This now raises the total of deaths in Nashville from coronavirus to 42. We have 3,889 confirmed cases. That is an increase of 10 cases in the past 24 hours. 1,438 of those cases are active, and 2,409 residents have recovered and have been cleared. The transmission rate for Nashville is now reported to be less than 1. That means, on average, 1 person will infect 1 person or less. In other words, it means the spread of the virus is slowing in our community, and this puts us in the green part in our metrics. There's also been some national stories recently about Nashville and about how we're one of the cities that's having a spike in the community, in the country. Now, I want to emphasize something. These stories are misleading, and they're not accurate. The reports are based on an unreleased May 7th White House Coronavirus Task Force report that showed that Nashville had an increase of 129% in a single week. Now, that's just not accurate. The number actually included data from 13 surrounding counties. The so-called national numbers also included Trousdale County in the week in which they had one of the worst prison outbreaks in the country. And also it included Rutherford County, during which that 1 week there was a 200 increased cases in Rutherford County, which is a large percentage for them. The facts are this, that during this time, Nashville and Davidson County had a 17% increase in cases during the 1 week reported. Now that is the accurate number, 17%, not 129%. Now it's important to look at the data as we've said from the beginning. And Mayor Cooper moved early based on the data and the science to issue a safer at home order and to begin testing. As I noted, Nashville has a transmission rate of slightly below 1. Nashville has not experienced the flood of hospitalizations that cities like New York have. I felt that it was very important to set the record straight this morning, and I want to thank the members of our local media who do understand the difference between Trousdale and Rutherford County from Davidson County. One thing to remember is Nashville has done a great job, and I'm grateful to all of my fellow Nashvillians for helping in keeping this a success. Mayor Cooper led the Southeast when he announced a safer at home order. Nashvillians have remained focused and strong and have followed this order. Our phased reopening has been praised as one of the most detailed in the nation, but we could still see and experience a spike if we don't follow the plans and stay the course. So Nashville, I'm asking you, please stay the course. Additionally, today, I'd like to report the latest race data that we have collected. The Davidson County confirmed cases include 35% white, 13% Black or African American, 13% multiracial, 7% Asian, 6% unknown, and 26% pending. Of the 42 Nashvillians who have died, 21 were white, 16 were Black, 4 were listed as others, and 1 was listed as Asian. As I've mentioned before, COVID-19 highlights the health disparities that exist in our society, where minorities and those with limited access to care are impacted disproportionately. Now, we also continue to make testing available to all Nashvillians. So far, our community assessment centers have tested over 12,000 individuals in about 6 weeks. As the mayor noted, the community assessment centers are open today and every day for 5 days a week until 3 p.m. Our community assessment centers are located at Nissan Stadium, at the old Kmart in Antioch, and at Meharry Medical College. If you feel like you need a test, please come and get assessed. And remember, the test is always free. Now today, I'm proud to announce that our partners at Meharry Medical College will begin managing the testing at all 3 sites. I appreciate our healthcare partners who have came together at the beginning of this crisis and allowed us to set up these centers. And these include HCA TriStar, Vanderbilt University Medical Center, Nashville General Hospital, Ascension St. Thomas, as well as Meharry Medical College. Nashvillians have had better access to testing than many others in the nation. I'm grateful to these partners who've helped us get the mission of getting a robust testing set up in Nashville, and I'm grateful now to Meharry Medical College for carrying the mission forward with not only these sites, but also launching a mobile testing center as well. Now, as we finished week 1 of phase 1, I want to remind you to stay focused, to keep doing what you're doing. Please stay at home, wear your mask when you go out in public, and keep your distance. We truly have done a great job, Nashville, of flattening the curve, and I encourage you to keep doing what you're doing. I'm grateful to all of you, and please keep it up. I now would like to introduce Dr. Hildreth from Meharry Medical College.
Good morning, Nashville. COVID-19 disease is caused by a virus called SARS-CoV-2. This virus belongs to a family of 7 human coronaviruses. And unlike some of the other viruses in the family that have been around since the 1960s, we've only been dealing with this virus for the last 6 months. What that means is there's a great deal that we don't know about this virus, but you need to know that every day observations are made that make it clear that we don't know very much about this virus. There are literally hundreds of scientific papers published on a regular basis, and even now as I speak in the U.S. National Library of Medicine, there are more than 10,000 papers that have been published about COVID-19. And despite the unprecedented pace of research and the observations made, as I said before, we don't know why some people get really sick when they get infected, while others have no symptoms at all. We know that pre-existing conditions like high blood pressure predispose some individuals to severe disease, but the truth is that some people with underlying conditions get infected and they recover. We know that children, generally speaking, do not get very sick from COVID-19. Yet, and elderly folks tend to get sick and die. Yet, there are kids who get infected who've died, and there are at least 2 individuals that I know of who are over the age of 100 who got infected and recovered. There are some questions about COVID-19 that we urgently need to find answers to. For example, we now know that everybody who gets infected makes antibodies. We don't know whether or not those antibodies confer immunity, and that's a question we really need to know. Over the last couple of months, in at least 3 countries, a really disturbing observation has been made. Individuals who got infected, some of them got sick, recovered, they appeared to get infected a second time. And in one case, the individual had been well for over 2 months and got infected again. This observation suggests one of 3 things. First, that the repeat test was a false positive. When viruses infect us, sometimes a residual amount of their nucleic acids, their genomes, stay around in our bodies long after the virus is gone. And the test used for COVID-19 is so sensitive, the PCR test, that it can actually pick up these residual nucleic acids and give a positive test. So in some of these cases, we believe the individuals may have had a false positive test. Second, some viruses can stay in our systems for extended periods of time and go dormant, or what we call in the scientific literature, latent. They can be latent. And a trigger like another virus or stress or inflammation can cause those viruses to replicate again and start causing disease again. That's the second possibility. The third possibility, which is most disturbing, is that there's actually a second infection, okay? So what that means is the immunity that we have is not long-lasting, or that the virus has mutated and the immunity no longer works. And that is truly a scary possibility. But those are the 3 possibilities for reinfection that we need to find answers for. The good news is that even though there's so many things we don't know about COVID-19, there are some things that we do know. We know that the virus is still out there, and it's going to be out there for an extended period of time. We know that through widespread testing, contact tracing, and quarantine, that we can stop outbreaks of the virus. We also know that by washing hands frequently, protecting our T-zones, wearing face coverings when we're out, staying 6 feet apart, and staying at home as much as possible, we as individuals can control the spread of the virus, and we need to keep doing that. The other thing I want to say is that I've been getting a lot of comments from individuals who seem to think that science is a nuisance, and that by speaking about the science, we're creating trouble for folks. Dr. Jahanger and I took an oath when we graduated from medical school, and it had a great many things to say about what we're going to do to keep our patients well and help them get better. The most important part of the oath that we took was something we pledged not to do. It was one of the first things we pledged not to do, is to not do harm. And for us not to tell you the truth about the virus and what it can do to us and our populations would be to do harm. And the 2 of us, and I think I can speak on his behalf, we're committed to living up to that pledge we made, not to do harm. So as long as it can be helpful in keeping people alive and saving lives, we're going to continue to tell you the truth about the science of all this. And so we're not going to do harm by not doing that. Nashville, we got this. We all know what to do. And so, as you've all heard me say before, please don't be a vector for COVID-19. We know how not to do that. It's now my pleasure to introduce or to turn it over to Dr. Adrienne Battle, Director of Metro Nashville Public Schools.
Thank you, Mayor Cooper, for having me here today, and to the rest of the leaders who are leading this effort. Starting this weekend, many of our MNPS seniors will begin the next phase of their lives in graduation processional ceremonies at their respective high schools. For some of our seniors, they are the first person in their family to graduate from high school, and this is a particularly tough time for them. I know that many of them have been planning all year for a graduation ceremony in May, which can't happen as it normally would because of the global pandemic. However, we want to give them the best, most meaningful celebration and ceremonies possible while putting everyone's safety first. I want to thank Mayor Cooper and Public Works for offering to light the bridge blue and yellow on Saturday and Sunday as a sign of congratulations for our MNPS graduates. If you are a business that can do the same, we'd encourage you to do so as well, or update your marquee with a message of congrats so we can show our support as a community. We're working with community partners on a virtual graduation ceremony that will allow the whole city to celebrate the success of MNPS graduates and show their appreciation for the work they put in over the last 12 years to be able to graduate. This summer, we are planning for in-person graduation ceremonies that will give our students a more traditional graduation experience. I think everyone in this room wishes they could tell you with certainty what it might look like in 2 weeks or 2 months, but really we don't know for sure. So we'll keep monitoring the situation and working closely with health officials to design a plan that will allow for a more traditional graduation ceremony if it can be done safely for all students, staff, and families involved. Now, we can't celebrate the success of our class of 22 enough, but I also want you to know that we are hard at work planning for the summer and 2020-21 school year to support those students who are continuing their careers within MNPS. The mayor's office and health officials have been very supportive of our plans to strengthen and enhance our remote learning options to ensure each child will receive a quality education whether circumstances beyond our control allow us to be in our classrooms or working remotely. We are finalizing plans for summer enrichment opportunities that can take place in a virtual setting to extend and promote academic growth prior to the 2020-2021 school year. Further details will be released soon. Meanwhile, we are continuing to plan for next school year. Our board is in the process of crafting an operating budget proposal for the next fiscal year, and we are exploring ways to use the CARES Act to ensure that we can remain in session in whatever format that looks like, in person, blended, or entirely remote, if the situation requires it. It isn't easy planning with so many unknown factors, but we didn't get into this profession of education because it is easy. It is hard work that affects individuals and communities immeasurably. Our team is working diligently daily to prepare for schools reopening in August. I look forward to updating the community and families we serve in the weeks and months to come. At this time, I would like to introduce Ginger Hauser with Nashville State Community College. Thank you.
Thank you, Dr. Battle and Mayor Cooper. I'm Ginger Hauser, Vice President of Economic and Community Development at Nashville State Community College. Since March, about 100,000 residents in our region have been either permanently or temporarily laid off. Nashville State has been working to help support these residents. We have partnered with online educational provider Ed2Go to provide 10 free online training classes for individuals who register by June 30th. Topics like 12 steps for a successful job search, marketing your online business, and personal finance are among the offerings. To find out more and register, go to workforce.nscc.edu. Nashville State is also working with the American Job Center here in Nashville to coordinate a series of Zoom sessions in the month of June for the recently unemployed. The dates and times will be listed on our college website, nscc.edu. As Dr. Battle said, our high school seniors are facing unusual times, and Nashville State is partnering with Metro Nashville Public Schools to coordinate a series of Zoom meetings with college staff for high school seniors and their families. The Zoom sessions are scheduled in the month of May on the 19th, the 21st, the 27th, the 28th, and the 30th. Visit nscc.edu/fall 2020 for details. We know that the hospitality industry has been, frankly, devastated by this pandemic. Nashville State has been working with Hospitality Tennessee, the Tennessee Board of Regents, and the Tennessee Department of Labor to support the restart of this important industry. This fall, the college will begin offering culinary and hospitality apprenticeships in partnership with these Nashville employers so that they will have a talent pipeline to support their reopening. Nashville State offers 21 Career in a Year technical certificates designed to get you into the workforce in a new career in 12 months or less. There is still time to register for summer classes, which begin exclusively online on May 26th. If you are over age 25 and do not have a college degree, you can still apply for the Tennessee Reconnect program and obtain a certificate or associate's degree tuition-free. Fall classes begin online, and we hope on campus as well, on August 24th. Go to nscc.edu for more information. It has been a pleasure to join you today. Nashville, stay safe and take care of one another.
Thank you, Ms. Hauser. We'll start today's Q&A session with Julia Palazzo at WKRN. Julia.
Good morning, everyone. Thank you. A couple of questions for Dr. Jahangir. Any concern about the number of deaths we've seen over the last week, including today's numbers? And second question, regarding that White House surge report you mentioned, have you spoken to the White House about it? And are you concerned about the impact it could have on the perception of Nashville? And then third question, not sure if you can answer this or someone else, but the masks, is it the same amount, 25,000 in that shipment? And how does the process of getting one work? Do people have a chance to get multiple at a time, or is it one at a time? Thank you so much.
Dr. Jahangir.
Sure. Thank you for the question. So regarding the 4 deaths I reported today, our mortality rate for the city is still around 1%. Maybe it's not 1.1, 1.2. It's still in line with national averages, if not a little less. I will tell you those deaths, if you noticed, those are when they were reported to us. One of those deaths happened in April that for some reason we just got the report of, so it might have happened outside of our jurisdiction initially. So not that one less death makes the difference. So it doesn't give me too much concern per se, in that these are older or previously medical condition people. Now, regarding the report, I'm glad you brought it up. I have not spoken to the White House. But frankly, I want everyone to know that it wasn't a released report, but also one should realize that look at the data. The data from that report is from Trousdale at an isolated prison outbreak, and it doesn't count. It doesn't count towards what Nashville's under. In the same period, as I mentioned, again, I want to be transparent, is we had a 17% increase. We now have stabilized the number of daily cases to about 80 to 100 over the past 14 years, or 14 days, excuse me. So I haven't spoken to the White House. I want people to know Nashville is getting ready. We were the first to place the Safer at Home for the Southeast. We're one of the last to reopen. We've been driven by data and science, and we'll continue to be that. So an unreleased report that somebody mischaracterized in a report, I appreciate everyone who's involved in this press conference for knowing the difference there. And then the final question regarding the masks, there are 25,000 that were distributed. As the mayor noted, they'll be this weekend in Southeast Resource Center. 16,000 have been given to MDHA to pass to all their residents. Each of our community assessment centers have about a few thousand to distribute to anyone that comes and gets tested. And then from what I understand from the state, there's 80,000 more, so 80,000 more coming, because the governor wants to have every Tennessean to get a mask. Now, when you come, if you'd like to pick one up for your family member, that we would honor that. You just say you want to pick one for your family member, and we're happy to do that. But again, every Tennessean will get one, so we ask everyone to be a good citizen, and if you're picking another one up, please really do pick it up for another family member or friend that maybe not be able to come get one. So thank you so much.
Damon Mitchell at WPLN. Damon?
My question is for Dr. Battle. Dr. Battle, do you anticipate that there will be a cost for summer school?
Did you say a cost for summer school, Damon?
Correct.
Okay. Dr. Battle?
Thank you for that question. Our goal currently for summer school is for it to be no cost to our families. We have an opportunity this summer to offer virtual summer school opportunities, enrichment opportunities for all of our MNPS students. That is an expansion over years past, and so we're looking forward to engaging as many of our students at no cost as possible. Thank you.
Nancy Ammons at WSMV. Nancy, you're in the air.
Hi, thank you. I have a couple of questions. First, for Dr. Battle, thanks for joining us today. Can you talk about providing computers to students so that they can do their distance learning? I just can't imagine what kind of challenge that is. And also for Dr. Jahanger, I'd love to hear his thought also on the quality of the mask and his thought on only 10 new cases today. Thank you.
Dr. Battle?
Thank you. With regards to devices, we continue to take reservations and distribute devices through the end of this week. More information will be coming out to families to advise you of our plans moving forward. To date, we have we're in the works of distributing close to 10,000 devices to our students and families. That is nowhere near the number we need to be at to ensure that all of our students have a device and definitely that they have connectivity. So we will continue our efforts over the summer and into next school year, hopefully relying on some of our CARES Act funding and some very good strategic planning with our administration. Thank you.
Nancy, thank you for the question. Regarding the 10 positives, I mean, gosh, I'm happy to report that. You know, that was out of a total of 630 tests that were conducted. So we had 620 negatives and 10 positives. So a 1.5% positivity rate, which is a lot less than our typical 9.5 we've averaged during this time. And I want to highlight that 9.5, by the way, is a good 1.3 points less than when we reported this last week. So I'm happy to say we're expanding testing and our positivity rate is dropping some, which is a good sign. But this, you know, the numbers go up and down, and we'll give you the average. But it is a good sign. Regarding the test, you know, or excuse me, the mask, the quality of the masks, I think, have been, you know, I think they function. You know, the recommendation of CDC is to wear a cloth mask that protects people. I have not physically seen one, but I think the state has really been working to get everyone those cloth masks work. And I know Dr. Hildreth, I know previously has talked about this, and he wants to comment further on this. So thank you.
I just want to remind everyone that the face coverings are part of an overall strategy. And they must be combined with the other things that we've talked about. And for the cloth coverings that you're going to be distributed, they need to be kept clean, first of all. You need to be careful not to reverse them so that the dirty side is facing you. That defeats the whole purpose of using the mask. So they need to be washed often. And whatever you do, and I've said this so many times, you must wash your hands, ideally before you put it on, and again after you take it off. And if you do that in combination with all the other things, those things in combination drastically reduce the risk of transmitting the virus. So regardless of the quality of the mask, do those other things to make sure you get as much protection as possible.
Our final question today is from Harriet Wallace at Fox 17. Harriet?
Hi there. Good morning, everyone. I've got a few questions. First, I guess it's for the health department. I know that testing will be done at the different MDHA properties. I know that we've seen some law enforcement quarantining. I just wanted to, if we could go on record, the testing that will be done at the MDHA properties, will the tenants there be required to take those tests, or do they have the option to opt out? If they are required but refuse, what would happen? And then my next questions are for Dr. Battle. I know that there is a discussion now about consolidating schools. I've got a couple of questions about that. One from some community members asking about consolidating this vulnerable group of people to the coronavirus. If you or maybe Dr. Hildreth want to chime in about consolidating a vulnerable group and exposing or increasing the risk of the virus. And then also, have there or will there be discussions with the city to address the reasons why there's such low enrollment at the North Nashville schools, such as gentrification? Thank you.
Thank you, Harriet. We'll start with Dr. Jahangir.
Sure, Harriet, thank you. Regarding MDHA testing, I will say it is a state-run thing, so the Metro Department of Health is not running these. But I do want to say this is really about convenience. They're offering free testing that is voluntary, and that's a very important point to highlight. This is purely a voluntary testing that's made for convenience. It'll be on-site at large scale for a community that has asked for it. MDHA has been offering the testing for residents at its tower properties for about 5 weeks now, and this state assistance allows for the community to deliver the testing that's being asked for by the residents, many of whom are seniors and many of whom may have underlying medical conditions or may have difficulty getting transportation to one of our community assessment sites or somewhere else to get the test. The testing has unanimous support of the residents associations, and MDHA staff will be providing masks for residents, as we mentioned earlier. So that's kind of where we are. Thank you.
Yes, in response to the questions regarding school consolidations, I think it's important to remember that as we're planning to reopen for the fall, it's all depending on our local plan and where we are. And so we definitely would be relying on our Nashville matrix, our reopening plan, and would not be opening up buildings until we deem it relatively safe to do so. Our current challenges have accelerated the timeline for implementing school consolidations, but our focus all along has been on improving student outcomes and strengthening pathways to increase student engagement and to improve student outcomes. Consolidations will improve the purchasing power for our schools so that they can have the necessary supports to support all of their students. A couple examples with regards to the consolidations to keep in mind. There is one recommendation regarding Jolton Middle School being consolidated into Haynes. It's important to remember that over 80% of our students actually live closer to Haynes. And in the Buena Vista and Jones Padilla scenario, we're talking about a school consolidation that's in walking distance. And so we have studied and researched these for some time now to make sure that any decisions we make regarding consolidations and improving outcomes for students really do that on behalf of students and families.
Thank you, Dr. Battle. We've addressed all the media questions in the WebEx queue this morning. I'd like to thank Dr. James Hildreth, Dr. Adrian Battle, and Ms. Ginger Hauser for participating in today's press briefing. Beginning next week, broadcast press briefings will be held on Monday and Thursday mornings at 9:30 a.m. The next scheduled COVID-19 press briefing will be televised on Monday, May 18th. We will continue to issue daily press releases with coronavirus-related health data and information to all local media. And residents can stay up to date on Metro's COVID-19 response at covid19.nashville.gov. Thank you for joining us. This concludes today's COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.